Hi, my name is Casey Fratt, and today my guest is Dr. Karen Goldschmidt. Dr. Goldschmidt is an assistant clinical professor and the department chair of the undergraduate nursing program at Drexel University. Today we will be discussing the profession of nursing and nursing education. Thank you so much for joining us today.
Thanks for having me, Casey.
Okay, so to begin, could you explain to us exactly what is a registered nurse and what are some of their responsibilities in the healthcare delivery system?
Sure. The registered nurse is the most important practitioner in the hospital setting, in the acute care setting, in the ambulatory setting, in the school setting. He or she is the person who is responsible for taking care or providing care for patients in those settings wherever they may be. And why they're so important is that they're the person who is at the direct line of care or at that point of care for taking care of patients. They are the person that is responsible for safety of the patient. Their job entails many things. For instance, we call it the nursing process. So the nursing process is their job is to assess patients. They also diagnose patients. So after assessing, what they do is they assess you holistically. They look at what is your mind, where's your mind at mentally, what's your spiritual well-being, what is your physical well-being, what is your environment, what's going on with the environment in your life. And they bring all of those pieces together, and what they do is they form a nursing diagnosis. And with that nursing diagnosis, what they do is they form a plan of care for you. And with that plan of care, they work with an interprofessional team. So this is where they interact with physicians, social work, dietary. So they bring the whole scheme of the patient care needs together. And then they implement that plan of care so that you get the best care that you need. And then they evaluate that. And then it becomes a continuous circle. One of the things that's important is that in our evaluation process, is it working for you? So if we don't take into consideration, what is happening in your home environment, if a patient comes in to see us and they don't have the socioeconomic funds to take care of themselves or to take the medications that have been prescribed to them, then we know that they're not going to follow through with their care plan. So that's what I'm saying about holistically. We look at all different aspects of the patient. One of the other things that nurses do is that we're advocates for our patients. So sometimes patients are infants. They can't speak for themselves. Or elderly who are really sick in the hospital and they also can't speak for themselves, or they may be afraid. So we look at all of the things going on. We may sit with a patient and a physician or another care provider may come in and the patient's afraid to ask or can't ask, and so we may ask on their behalf or we may communicate on their behalf because they may sometimes freeze and not be able to say it. So we will ask those questions for them, or we listen, and sometimes the care provider will leave and then they ask us the questions because they feel comfortable. As a nurse, we have this incredible ability to be with the patient 24 hours, 7 days a week. And that is such a intimate time to be in a patient's life. And when no one else can, sometimes not even the family can be. So they'll confide in us and they'll tell us things, and then again, we become the advocate. So you may have a physician come in or another care provider come in and if you feel intimidated, if I'm your nurse, I can say, Casey, you discussed this with me, some of your concerns. Would you like to discuss that with your primary care provider so I can help you initiate that conversation? Mm-hmm. And nurses are everywhere. We're in the community. We are working with school systems, mm-hmm. with kids. We're working in homeless shelters. We're working in hospice. We bring patients into the world and we help people leave the world. Mm-hmm. So we're there in, again, like I said, the most intimate moments, mm-hmm. of a patient's life. And we're also in the neighborhood. I, as a pediatric nurse myself, I was always the person in my neighborhood that people knew, if a kid got injured, they come to me. So you have a special expertise that they trust. Nursing is the #1 most trusted profession. So there's this trust that we have with the community, and we've been probably over 8 or 9 years now labeled as the most trusted profession. So people will come to us and trust and ask us about, any questions that they have. So it's interesting to be given that level of trust. And with that trust comes a great deal of honor and respect, and a great deal of ability to be able to take that and advocate for our patients.
Mm-hmm. Absolutely. Okay, so I understand that there are many different ways that someone can become a nurse. So could you explain to us some of those career pathways, and could you tell us what is the typical education that a nurse receives, and also maybe describe a little bit about the typical candidate that is looking to enter the nursing field?
Okay, well, this has been a conundrum in nursing. So since 1965, the American Nurses Association has been promoting that the bachelor's degree be the entry point for nursing. But before that, most nurses were trained as apprentices in hospitals, and that was the diploma school of nursing, and they still exist today. And then later in the 1970s, early 80s, we had associate degree nursing programs, so 2 years. So we have 3 entry points into nursing. We have the diploma program, which is hospital-based, kind of physician-driven to begin with, hospital traineeships, which were 3-year programs. And then we had associate degree programs where we really saw that the hospital environments were becoming very complex, and that nurses needed to be trained in a program that had more of a college background to it. And then in 1965, the ANA, the American Nurses Association, said that we need nurses. The hospital environments are becoming so complex, meaning that patients are sicker than ever. And we need nurses who can communicate in the healthcare system, learn about the science behind nursing, and develop the science behind nursing, and work in complex environments and in teams. And they said that we need to have them trained in a bachelor's degree. So since 1965, the nursing profession has still not decided where we are going to be as far as there's no single entry point. So all 3 of these entry points sit for one licensure exam, and it's a national state licensure exam. It's called the NCLEX exam, and they're all prepared for basic nursing care, okay? So you can go for 3 years as a diploma, 2 years as associate degree, or 4 years as a baccalaureate degree. Now, we're getting closer. In 2010, there was a report out of the Institute of Medicine, and that was funded by the Robert Wood Johnson Foundation and Institute of Medicine, and it's called The Future of Nursing. And this called for, by the year 2020, that we wanted 80% of nurses to be educated at the bachelor's level. Reasons for this, that we have research coming out of by Dr. Linda Aiken out of the University of Pennsylvania, who has shown that nurses who are prepared at the bachelor's level have better patient outcomes than nurses who don't. So what we're seeing in the market and industry right now is that the driving force is that we want hospitals now are not paying for patients that are admitted within 30 days of hospitalizations. We are not getting reimbursed by third-party reimbursement in hospital settings for patients who have never events. For instance, events that infections that are happening in hospitals, for patients who are maybe have a wrong site surgery. So we can't have less educated nurses, because what's happening is that third-party insurers are not paying for that. So those nurses who are not educated as highly, okay, are not going to help contribute to positive patient outcomes. The ones that are the baccalaureate prepared nurses. So what's happening in the marketplace right now, and the market drives what happens in education, is that in this area, in the East Coast, hospitals are not hiring nurses unless they have a bachelor's degree. And they've also started to push to say that nurses have 5 to 10 years in some hospitals to get their bachelor's degree, or they don't have a job, or they can't promote to another area. They can stay there in that area that they've worked. They don't have another job in another area, they have to stay where they are. So we're seeing a big shift right now. So we still have a few diploma schools in this area, and we have the largest majority is still associate degree programs, and we have baccalaureate programs. One of the major issues with all of this is that we have a severe faculty nursing shortage. So we have turned away tens upon thousands of nursing students away from schools because we don't have the educators to teach them, which is another dilemma. And then we have an aging population that's getting bigger and bigger that needs care. So we're at a crux right now of why, where we're going to get these nursing students. So we need higher educated students. Associate degree students are known to go back for one more degree. That's what the majority of them do. So what will they do? They'll go back for the bachelor's degree. So if we can only get them back for one more degree, and less of that, or more of them are in the associate's degree, we know we need to get them to the bachelor's level. We need them to go back for a third degree. We need them to go back for the master's degree. Why? Because we need them to teach. They need to have at least a master's degree to be able to teach. And even further, to be at a university setting, they need to have a doctoral degree. We only have 3% of nursing's population that have a PhD, which is really minuscule. The other big push right now, many of them are going back for a doctorate in nursing practice, which is a practice degree. Many of them, which I'll talk about a little bit later, are taking care of a lot of primary care needs. You also asked me about what the typical student is that comes into our programs. Who typically comes back to become a nurse? So you do have nurses who are choosing nursing, or students choosing nursing out of high school. They're looking at cost. So if you look at cost, the lesser cost is the associate degree program. Okay, coming out of, and that's generally housed at a community college. The higher cost is at a bachelor's degree program. So parents will weigh and they'll say, why don't you're sitting for the same test, why don't you just go to the associate degree program? So you think, well, the reason why not to is because what is the gainful employment in the end? Gainful employment, they're not going to get that mostly in this area. Rural areas they will, or they'll get a job in long-term care. And they come out wanting to, I want to be a nurse practitioner, I want to work in pediatrics, I want to work in critical care. They're not going to get jobs in those areas. The prime group is the bachelor's student. Those students are positioning themselves that they will most likely get the job that they're after. So what's happening now is that associate degree nurse will do two things. They'll come into the RN to BSN completion program, which is the program that I'm working in, which is a degree completion program, so they have to go onward, or they try to find a job in a long-term care facility so that they'll get some tuition remission from their employer, or they're working for very low pay in a primary care office. There is other routes. The other routes that I'm seeing right now we're all seeing right now, is that many students are choosing nursing as a second degree. So we have students who are bachelor's prepared in another field, a BA, a BS, or a master's degree, who are choosing nursing usually at the age like 30, 35. And so they're choosing, there's accelerated bachelor's degree programs. So we have one here at Drexel, it's called our ACE program, and those students go full-time for 11 months and they get a second bachelor's degree in nursing. They cannot work, they do clinicals, they go full-time, they get a BSN. So they may have a BA, and a BSN, or a BS and a BSN. A lot of them may be people who got jobs as engineers or in the business world, and they may have been in the hospital. You often hear that they were in a hospital and were affected by a nurse who took care of maybe a family member, and they will say, I think I really want to help people. And so they come back, and we have anywhere from age 30 up to 55. And they come into the program, and they're dedicated, they're hardworking, and they will go through that 11-month program. We also have, what I also see happening is that they're boomeranging back into the community college. So they don't want to pay the price, because it is expensive to go for that 11-month program. They decide to boomerang back and become an associate degree nurse. That's tricky, because what happens is they have a BA or a BS, and they say, I'm going to sit and go through the associate degree program. But what they come out with is an ADN. So they're not able to be gainfully employed because they don't have a BSN. So what I'm doing right now is I'm trying to work with the community colleges. And I have one program right now with Delaware County Community Colleges where I'm trying to do concurrent enrollment. So they can start their BSN while they're enrolled in the associate degree program, so they can get a head start. They're 35 years old, they're working professionals, they want to start moving forward, and they can't get a job when they finish. So that's kind of how we're approaching it. And what's nice about that group of people is that they want to become nurses, and they have this desire, they're committed, they are, they have this desire that I haven't seen in a long time in nursing, where they say, I'm going to work really hard because I want this. Mm-hmm. So you can see there's a lot of different pathways coming in. I actually have a student right now who has an MBA who wants to become a nurse. So they're highly educated, mm-hmm. but they're finding that I don't want to sit behind a desk anymore. I want to give back and give to people, and I want to become a nurse. Mm-hmm.